Ladies and gentlemen, welcome to the Merge Medical Podcast. I'm your host, Dr. Jeff Brown. I'm joined by my co-host, Dr. Jeff Cole, Brant Herman, and Dr. Carolyn Brown. They are the founders of MouthWatch and Dentistry.One. We're going to visit with them and learn all about it. Guys, welcome aboard.
Thanks so much for having us.
Tell us about MouthWatch.
MouthWatch is a company in the dental space that broke some new ground about 12 years ago with a focus on connecting patients to their dentists outside of the traditional office setting. So we used a SaaS platform and telehealth technology to allow practices to communicate with their patients once they'd left their appointment. So some use cases were monitoring healing, or if someone was traveling, or if there was an extensive case, trying to take some of the appointments that didn't always have to happen in the office and make the office more productive because they could fill that with kind of higher value, more urgent treatment, while patients had all the convenience that we'd seen in telemedicine, but really specialized and tailored to the dental patient experience. Since then, we've grown. We have a hardware component, which is an intraoral camera that dentists can use or other healthcare providers can use to show patients more clearly what's going on in their mouth. We like to say that patients didn't go to dental school. They don't know how to read an x-ray. They can't look at a radiograph and understand what's happening. They definitely can understand a photo or a video of their oral condition, especially when it's magnified on a screen 30 inches in an office. So we're the largest intraoral camera company in the United States. We're in over 42,000 practices. We work with some of the largest DSOs and are really happy to be able to, I think, improve the dental patient experience when they're sitting in a dental chair in that traditional journey, and also facilitate practices expanding their touch points into patients where they might feel more comfortable or where it's most convenient for them.
So when you say that, I'm envisioning like an ER or a pediatrician's office using your camera and sending it. Is that how this works then?
In some cases, yeah. Sometimes just the camera being in any non-dental setting is really helpful. Nursing homes, school nurses, emergency rooms, pediatricians' offices. There's a lot more movement toward medical integration with dental, where you can see pediatricians' offices now can get reimbursed for applying fluoride varnishes or silver diamine fluoride, which arrests decay and allows patients to not further any tooth decay. So in a range of those settings, our cameras work really well with Teledent, which is our SaaS platform, and Dr. Brown is our Chief Dental Officer on Dentistry.One, which is a new platform we've launched and a new company we've launched, which is where we don't have to just supply the platform and hardware to a group where they're providing the doctors. We actually now have a nationwide network of doctors, so we can be that virtual first layer of care and then refer patients into brick and mortar practices for treatment.
So does it require the use of your camera, or could you use an iPhone?
Carolyn, you can speak to that.
Sure. Yes. No, through Dentistry.One, our teledentistry network nationwide, you can connect through your phone. You don't even have to download an app. So we've made it as simple as possible. You can use a QR code. We can text you a link to connect with us. Mm-hmm. But certainly if we're talking about, asynchronous or other types of modalities, things can be heightened by using our camera. If you're in, a location, for instance, you're in a medical office and you're taking some pictures using our intraoral camera and either connecting with us live or asynchronously. We've basically built it for as much agility in both the software and the healthcare provision types of aspects.
And Jeff, let me ask one more question on the overall process. Beyond the obvious question that comes to my mind, or anyone watching or hearing this, would be if you're using a camera remotely, you can give some advice, you can make some diagnosis. Beyond that, is there anything diagnostic that could be done, because the dental provider, at least in many of these cases, is not physically present, right? Can you speak to that?
Sure, I'd love to speak to that. I mean, it's very akin to going to see your PCP and you walk in and you go through a list of symptoms. There may be some clinical information that they take, but it needs to be confirmed through some other type of diagnosis or radiology, those types of tests. So it's coming up with the different diagnoses, doing as much as you can for that individual, and connecting them to brick and mortar care when that seems appropriate.
Okay. So can we back up just 1 second? So Jeff queued it up that you guys were the founders of MouthWatch. Is that true?
So I founded MouthWatch with my father, who's a dentist, and Robert Bellhouse, who's our chief operating officer. And then as we grew with teledentistry, we found a kindred spirit in Dr. Brown, who has a lot of experience in teledentistry, in running a federally qualified health center in the Bay Area that really grew and started to utilize a lot of this technology to transform care. So Carolyn has come on and helped us not only on the innovation side of MouthWatch, but as Chief Dental Officer for Dentistry.One.
Very good. And is MouthWatch a private company?
Yeah, MouthWatch is a private company. We've been an Inc. 5000 fastest growing private company for 3 years running. So we're excited with the growth that we've experienced on that side. And teledentistry had a heyday that came out of a pandemic. Prior to that, it was really in a public health program and a mobile program where we thrived. The pandemic shutting down every practice really started opening people's eyes. And more importantly, for lasting change, I think reimbursement and policy that really has created a fertile landscape for transforming dental care by making it much easier to access and not always waiting for chair time to be the only way you can deliver care.
I think it's one final question in this stream. What was the driving force behind Dentistry.One as a subsidiary? If MouthWatch is already a strong, successful company, is it marketing? Is it or is it just truly a different?
That's a good question.
What is the driver there?
Yeah, so MouthWatch is a company that's a software and hardware company. It's not a dental support organization. So Dentistry.One, the nature of structuring it separate from MouthWatch is its primary role is a DSO. Yes, we're a DSO that builds software, that provides a range of other solutions, but in structuring it, we have to have professional corporations in each state in order to deliver care. So Dentistry.One becomes this virtual DSO that facilitates services supporting our nationwide network. Dentistry is not as far ahead as medical on interstate compacts and some other solutions that really help medical care translate to telehealth. So we're picking up the slack, and in order to deliver that care to each state where it's allowed by law, which is most of them, we have to set up that PC and then provide these support services, marketing services for Dentistry.One. The other aspect that's beneficial just on the business side is MouthWatch is a growing, successful, profitable entity. So we didn't have to take in VC money to grow and build out Dentistry.One. We really have a lot of runway with it. We can self-fund the growth and development of it, do it right without having to compromise wrong product market fit or client fit in order to get this thing going.
So Brant, this may be an oversimplification, but is it fair to say that MouthWatch then is more the hardware software side, whereas Dentistry.One is the clinical side, and you've got Dr. Brown, that's probably the clinical chief officer in each state? Is that accurate?
So she's the chief dental officer of Dentistry.One and our DSO. There are some PCs that she's the owner of, but we have a network of other doctors that we collaborate with to facilitate care delivery across the country.
And if I can add to the story, one of the things that I think really led to the formation of Dentistry.One, Bob and Brant and Brant's dad are sort of true entrepreneurs at heart. And they, nailed the business of MouthWatch. There's no questions about this across the industry. And they watched the opportunities arise and really waited until they were ready and saw a clear line of vision about how to build something that wasn't just going to be, a flash in the pants triage type of opportunity, but really, how do we look at healthcare 5, 10, 20 years down the line and make it very accessible, not only on the dental care side, but how are we going to plug in to hospitals and doctor networks and really be able to get to the health outcomes and the health savings. And there's a myriad of ways that we've helped to create Dentistry.One. And it's really this like very innovative spinoff from this very venerated, hardware software business. On the
I love it.
side.
I love it. And it sounds like you are really partners with the dentist, not competition at all, because I can see where this would be a real referral driver, right?
Yes. So
Yeah.
that is exactly what we are trying to do, be it we're the virtual front door or the first touch point. We know that only 38% of adults across the country actually see a dentist every year. And that's, plus or minus 2 percentage points, regardless of what type of coverage or insurance or lack of insurance they have. So we're looking at 60% of people don't go to the dentist. Why is this? We know from all kinds of research, and it changes a little bit based on, insurance type, but it's fear, it's cost, it's transportation, it's hours, it's the time it takes. Once you see a dentist for every appointment, most of them aren't 10 or 15 minutes long. So when we take all of those things into consideration, and then we actually look around, okay, we're in the year 2024, and people are used to things being instantaneous. They're used to being able to ask for an appointment and get it within a day or two. And most dental offices are booked out, 2 months, 6 weeks, 4 weeks for a new patient appointment. So we really understand both the consumer needs and can see very clearly what we think others can't, kind of this blue ocean strategy, and have been able to build a very cohesive roadmap of what we have in place today and able to activate quickly on where we can sink in like puzzle pieces to the rest of the healthcare ecosystem.
What about with the medical community? Is it really a one-way communication, or is it, because I'm thinking about ENT doctors, I would think there are times that a dentist looks in a mouth and goes, wow, you need to go see an ENT, and vice versa.
Yeah, for sure.
Is there kind of a two-way path here?
Absolutely. We see this as a two-way path. Everything from nurse triage lines that cover, hospitals and large group settings for MSOs on the weekends. They don't, if they know how to, they usually have like one script of like, okay, we're just going to give penicillin. This is where we can sink in and be peer-to-peer resources with all types of entities. And we've seen this, with school nurses across the country who utilize the MouthWatch cameras. And so, it all comes down to, we are at its core a software company. And even the hardware, our cameras sync very seamlessly with most practice management systems. And if you've ever bought x-ray, systems, which usually as physicians you haven't, but for dentists, this is constantly a problem. You might have the world's greatest sensor, but it doesn't somehow connect easily to your practice management system. So with this software kind of backbone, and the idea that we not only understand that we have to be a fintech business as well, the connection, is meant to be as easy as possible for that bi-directional connection into all types of medical care settings and providers.
That's
I'll
super
just
cool.
add to that. I mean, Jeff, your comment about kind of a two-way street, I think we would love the idea. I think the knowledge is there on both sides of a really siloed delivery system, but the means of doing that is really blocked by just the structure of how dental practices are not really integrated into ASOs or MSOs. They are separate practices. So even in the best case, you might have a patient who's about to go in for chemotherapy and all of the side effects that will impact their oral health from that, or a diabetic where their outcomes improve significantly when their inflammation in their mouth is treated properly. The burden still falls on that patient. So you might have the oncologist who says you definitely need to go see a dentist, get a cleaning before we start treatment. Great. Now this patient, in the midst of all of the other medical issues they've got to manage, they're now trying to find an appointment with a doctor, and God forbid they're on Medicaid, then you're talking 60 days out for them to potentially begin being in the best position to start treatment on their medical side. So we're really seeing Dentistry.One can act as this digital bridge between two systems that are going to take a long time before they're all under one roof. And we can be the way where doctors can easily, whether it's scan a QR code, as Carolyn said, or invite a patient to begin that consultation. And that's a key part with Dentistry.One is we're not just doing the virtual consult, we're actually facilitating care coordination to get that patient into treatment in an office. So we recognize that we can't do restorative procedures. There are some preventive procedures we can help facilitate, but we want to make sure that we're getting someone into a chair so that they can get the treatment they need and really start closing these loops and revealing, I think, a better patient journey that leads to these better outcomes.
Well, it's clearly more efficient, and each of you has queued me up with, I've got a lot of questions, but 2 use cases that I want to get specifics about. Dr. Brown, when you talked about the nursing line, I was like, wow, yeah, okay, I can see where someone's got a tooth issue. Maybe they've got a toothache. They don't want to go to the ER, right? So they can call the nurse line, and the nurse line can then hook them up with you, where
Correct.
a virtual visit can take place. Someone can say, yeah, you've got an abscess. I can phone you an antibiotic, and then we need to see you a day later to see if it's resolved or whatever. And then Brant, you talked about cancer. My uncle is a dentist, and people don't understand a lot of oral cancer is diagnosed by dentists.
That's right.
And it can't be diagnosed if no one ever saw it until it's a really problem, and then they seek care. So those are 2 use cases I didn't even imagine, but ED diversion, diagnosis of cancer or infection. Let's talk about that a little bit. And with that, I want you to take me through like a patient journey, like from start to finish. Like I want to be a patient, right? So tell me how that works and maybe use those as examples.
Yeah, so hopefully you're not in an emergency room. We know 2% of all emergency room visits are dental tooth pain related. So we are trying to work where, one, patients know they have access to this before they even get in the car to go to the emergency department, but even working with emergency departments that before I'm waiting, and in the terms of priority in an emergency room, tooth pain is going to come real low. So you're going to have a negative experience, you're going to wait a long time, and you're still going to get a treatment typically that we're going to be able to provide to you virtually of a referral, maybe an antibiotic, some tips to help manage that pain, and then we'll get you into an office as soon as possible. So
Brant, how did that work? So Jeff Brown's at his house. He's got his keys in his hand. He's about to head to the ER because it's just killing him. What's the light bulb moment for him to go, oh, wait, I need to go back and turn my computer on? And what are the steps?
You bet. Yeah, so if Jeff's got a great insurance company, first of all, they've probably been messaging him or letting him know this is a service that's available as part of his dental benefits. It doesn't all take place in a dental office. So he might know that he's got a virtual dentist option and he could talk to us. In that case, he would go open up a browser, fill out an intake, tell us, maybe take a couple of photos. We're incorporating some AI that could help identify if there's inflammation or some recession issues that are not triage of emergency, but might engage him more regularly, where he's very comfortable. Hey, I want to check this out. I want to see how I'm doing. Knows there's a virtual dentist option and then can talk to us. But if he's having an acute issue, in that case, we would want him to submit some information to us, take some photos, which with a cell phone are surprisingly diagnostic and helpful for our dentist to understand the issue. We're going to then take that, we're going to share it in and find an available provider in our network, licensed in the state where Jeff is located, that we can provide care to him. So that information will go to our doctor. We will round robin it to a provider, adding more and more expertise based on what we know Jeff's experience is. So if we've got a doctor on our end where we know Jeff might have a chronic condition or be in some circumstance or a language, we're going to try to route to a doctor who's best trained and educated to treat that patient. Then Jeff can get into a live video consult with the doctor if that's what he chooses, or those images could be reviewed by the doctor and get a treatment plan back to you. And from that consultation, we're going to share our summary of notes in, a standardized note format that's also really easy to understand for the patient. If we need to e-prescribe an antibiotic or anything to help Jeff get to a smarter intake for a physical appointment, we don't want it to be two things, right? There might be two travel instances typically. One would be to the ED or to a dental office where they're going to say, we can't do anything right now. We're going to prescribe something. And then your follow-up visit is for the treatment. So we've saved you that appointment. We've helped you understand what it needs to be. One great thing about our experience with MouthWatch too is in 100 practice group where we fully deployed teledentistry, we knew that 31% of emergency calls never needed an office visit. So we're telling practices, look, we've got a large number of chair time, right? An amount of chair time that's being taken up by a patient who thinks they're having an emergency, they're having some issue, but it doesn't have to be resolved physically in chair. So we can free up that time. Jeff's had a much better experience because he sat in the comfort of his home, talked to a great doctor who understands how to do a telehealth consult and evaluation for dental care. And then we can help him. So if he has a dentist, we'll take that burden off of Jeff's plate and say, we'll book an appointment for you as soon as possible. You don't have to do that. And our care coordinators will book that appointment, confirm with Jeff, and then you're in for physical treatment should that be something you need.
How do dentists find their way into your network? And how big is your network?
So that's where it's great. With MouthWatch's footprint within practices, we have a great reputation. We've recruited more providers than we need right now. So we have some dentists on waiting lists, depending on kind of scale of a state. But we've got over 400 dentists in our national network right now, kind of peaks in states with higher populations and higher need. And we're in great shape as far as the providers. And then we went the extra distance. And I think to what Carolyn was saying, we didn't want to do this where we're kind of half-baked coming out with just something to be filling a perceived gap without doing it right. So what we do for our dentists, and I think it's also because we have a great reputation in the dental community, and we didn't want to come out with something that lessens that reputation. So we offer medical malpractice for our dentists who join our network. We are supporting them in education, providing CE, providing additional training. We have telehealth specific curriculum that really helps them provide a better screen side manner and approach to an oral health consultation, and really plan on continuing that.
And what if, and Dr. Brown, 400 dentists in every state? What if I'm out of town? How does that work?
If you have a dental practice, Jeff, and you're out of town, how does that work? Or if
I'm the patient. I'm still the patient.
You're the patient. Yeah. So there are a few states, and this is another place where MouthWatch's history and policy around teledentistry from its very early days in the early 2000s has a really good pulse and very close relationships and investment in teledental and telehealth policy. So there are a few states where if you're, insured in the state of Idaho, you have to have a teledentist within a certain circumference of where you are. So we do ask some of those questions, and our care advisors, when they first connect with you as the traveling patient or the traveling consumer, to make sure that we are, connecting the dots on wherever those policies might be a little wonky. But we would connect you with a provider in the state where you're located, or with your coverage, and try and understand that concordance.
And I imagine when you make the contracts with the insurance companies, those things are specified.
That's correct.
So I would imagine minimal disruption, right?
That's correct.
Yeah. And would there be any state where you couldn't do this currently? Because you said dental is not as caught up as medical on compact and so forth.
Yeah, I'll let Brant speak to this. We're making some headways, but I think that Georgia and Ohio are sort of the two states today that are, had some executive orders during COVID. Those orders expired, and we're left kind of with no clear okay for teledentistry in those states. Am I correct in that, Brant?
Yeah, Ohio sees teledentistry more as, let's say, a dentist between a dentist and a hygienist. So a hygienist could be out at a school seeing kids and then communicating with the dentist, not the dentist direct to patient. Georgia, despite 20 counties that have no dentist, just kind of put a little kibosh on any teledentistry taking place. But I think you're seeing, by and large, 47, 48 states know how to embrace it. Some are much more appealing, and for us that they can make it live video or it can be asynchronous. Some states specify synchronous, but we really have our finger on the pulse on that and do a good job because it's been such a key part of our business for quite some time. One point to kind of what we were talking about earlier with our dentists, a nice part of the way we're structured too is the dentists that are in our network might have state licenses in multiple states. They used to live in New York, they're licensed in New York, New Jersey, Connecticut, then they moved to Florida, they've got some other states along the way where they've worked. We can help them tap into patients wherever they might be licensed. So we can help maximize value of that provider's license that typically they wouldn't be able to. The other part is when they're affiliated with our PC, even though they might work 3 days a week clinically in a practice, with our PC, we can enroll them in every potential insurance plan. So we come to states and we say, look, we've got 20 doctors in the state. We want to enroll them in your Medicaid plan and help you transform your access to care issues. So it's nice in that we can take providers who may not want to approach a Medicaid or some type of public insurance when they're traditionally practicing with us. They're more than happy to, because we're still driving patients and getting them the reimbursement that they're looking for.
And I could see it being super cost effective.
For sure.
I wanted to go back onto something that we've been sort of talking about, which was, this piece about rural and extreme rural areas. I did some research a couple of years ago with the state of Alabama and the Centers for Disease Control, and something like 52 of their 56 counties are considered extreme rural. And of the dentists that are practicing currently, something like 82% of them are going to be retiring within the next 5 years.
Is that right?
And the average age is already over the age of 75.
That is crazy.
So we do have this, coming storm of rural shortage. We already have it in many places. Whether you're self-pay, commercial, or on a public program, dentists in general are staying closer to suburbs and in cities. So I do think there is also this use case around, really proving the point with telehealth and teledentistry in some of those more rural areas because of just zero access, or a patient may have access, but they have to drive 45 minutes each way, etc.
Yeah, I think it's 70 million. Yeah, 70 million Americans live in health provider shortage areas when it comes to dental. We see a lot, like I mentioned with Georgia, of just counties that have no dental provider. So you're talking a lot of time and distance, and typically in that population, sometimes when they are looking for 31% of dentists accept Medicaid. So you've got this combined challenge where you might be rural, you might not have access, and now you've got a provider shortage, right? And you've got a lack of reimbursement that's not going to allow any dentist who might be local to really accept the plan that actually covers you.
And it's amazing the disparity in care. I've worked in cities and currently work in a rural market, and it is just staggering the difference in health and dental care in particular. Like, I'm an anesthesiologist. I didn't say that at the beginning to you guys, so I'm always looking in someone's mouth before I take care of them. And I'm working in North Mississippi, and nobody has teeth. They're 40 years old and they don't have teeth already.
Right. Yeah, and then you start seeing data on indentualism tied to increases in other chronic conditions and all these correlations. So that's what we love is, like, from a simple URL or a barcode, a QR code, we can take any of those touch points that a rural patient or anyone might actually get into care and really add a dental care layer to that immediately. You don't have to wait for them to specifically go to a dentist to bring them into the care system. And I think a point you made earlier, Jeff, was, this referral approach to providers. So when we see 60% of people aren't seeing the dentist every year, some dentists, I think it's a growing minority, are concerned, oh, you're taking a patient away that was going to come see me. This patient wasn't coming to see you.
Yeah, they weren't coming anyway. Right.
You more patients and really help make you more efficient in how you deliver care so you can see the number of patients. We just know that the current number of providers in the dental care system couldn't meet the need if people saw the dentist the way they're supposed to. So we've got to bring efficiency and innovation in a way that really can help more people get at least that foot in the door and overcome some of those biggest challenges, which is fear, right? Anxiety, pain, cost, and distance. So I love that we can kind of sit on your couch. We're going to help you size up what it might be, help you understand the importance of your need, and then make that a visit. When you do decide to go in, you're more informed, your provider knows what's coming in, and it's going to be something that's a more positive and accessible experience.
So I wanted to get a little more specific on the revenue model, and I'm a finance guy, so we'll talk about that. But the dentists that are in the network, when they get a referral, their fee is just their office fee for the services they provide. No, there's an arrangement. Okay, tell me about that.
Yeah, so the dentists that work with us are contracted to the PC, so they'll get a negotiated rate based on the service they provide to our Dentistry.One patients. Mm-hmm. When we refer to a physical practice, we're not getting compensated for that. We're doing that as part of the service offering to make sure that patient has a positive experience. Mm-hmm. And depending on our contract with, be it a payer or an employer or a healthcare system, there's a range of approaches that make sense there. Sometimes the reimbursement is enough to cover it. Sometimes there might be a PMPM for the membership to access not only maybe the baseline, but also enhanced services. So we're doing more in an oral health coaching approach, where if we know patients are at a higher risk, maybe there's a cohort of patients that are pregnant or that are diabetic or have cardiovascular issues, we can drive better systemic healthcare focusing on the mouth to those members. And really, we think bring down the cost of their medical care by engaging them more actively in dental. So we've got a range of other services and compensation that helps make this system work and ultimately save costs in a lot of systems where we talk to employers and employers are looking self-funding their own benefits and they're paying for all of these medical expenses that we know there's a proven benefit and a cost savings that comes, but it's connected to the dental plan. Mm-hmm. And typically those aren't communicating that well. That's kind of comes back to this digital bridge is we want to look at your highest cost, highest risk patients. And if there's a dental improvement that we can reveal kind of a medical cost savings and a medical outcome improvement, we're the best position to do it. You're never going to get that from a network of doctors, no matter how educated, forward thinking they might be. Patients are still going to that physical brick and mortar dental practice and can't take, I think, the macro view of how to really significantly integrate within benefits and healthcare dollars that are being spent.
Yeah, a little known trivia, appropriate time to say this. I'm a cardiothoracic anesthesiologist, and we used to joke that no one in the heart room had good teeth, right? You never saw someone with great teeth getting a bypass, ever. And it's been proven now that it is indeed. It wasn't just an observation that I made and I was wrong. It's proven right. And another segue, we podcast a group yesterday that would have some synergy with this group. I'm quite confident they're doing a direct primary care model, and this could be a plug and play for what they're doing. And they go to employers and they're self-insured, and there's no Blue Cross Blue Shield Cigna taking off 40% profit to do very little, and the patients pay less, the doctors make more, the patients get better care, and it's focused on health care, rather than sick care. So this totally fits with what you guys are doing. Don't you think, Jeff?
Yeah, more than just direct primary care. They've deconstructed insurance and they've built it back with all the individual pieces, mm-hmm. where each of those pieces benefit the members, the providers, and the employers who are the clients. The only one that loses are the big insurance carrier.
That's right. That's right.
There's no tears shed there. So yeah, I'd love to see how the dentistry piece would kind of plug into what they're thinking.
Well, the dentists have been smarter, in my view, managing that than the physicians have. And I want to talk about you guys, your founders. If there's other members of the leadership team that you think need mentioning, I want to know a little bit about each of your backgrounds for our viewers. Take your time. Let's start with Dr. Brown.
Hi, I'm Carolyn Brown. I'm a dentist, a general dentist by training. My early career was really spent in public health. I was part of the Indian Health Service and grew a FQHC from a 2-dentist, 2-location entity to, I don't know, maybe 70 dentists and 25 or so locations. We were sort of at the forefront of mobile and alternative modes of dental delivery, including teledentistry. I was faculty at a couple of dental schools and really got involved in innovation as part of this public health work. I was writing grants with NIH, I was on NIH review panels, and started really getting involved in healthcare software in the early 2000s in the Bay Area. So this was kind of before, digital health and health investing was a thing. And have just been, really fortunate to have, I then went into consulting and advising and investing and have been sort of playing in those 3 areas ever since with, some large payors that have been my clients for many years, meeting and working with Brant and the MouthWatch team, and other companies that are even, smaller and earlier in, the startup phase. But I do really have conviction through some of my work in developing algorithms and looking at value-based care with ACOs, in the 2010s with Dartmouth, that, there is this coming, efficiency and right sizing of some of the cost. So I continue to try and translate that. I know it's not perfect and it's way more complex in the medical side, but continue to work with people like Brant who just make it easy to kind of see the future and, people who are willing to invest their time and energy. So I'm really proud and privileged to be working with MouthWatch and Dentistry.One for all of those reasons, because it's the right founder team. They've already proven success. They have a team of 40 dedicated people. And I also just really like working with good people, and these are good people. So, that's some of my background and how I came to MouthWatch.
And Dr. Brown, where are you located and how did you meet Brant?
Yeah, I met Brant through CareQuest Innovation Partners. CareQuest and DentaQuest were long-term clients of mine, and I helped to sort of advise and work with CareQuest in their early days of investing. And they're one of the minority investors in MouthWatch. And they sort of loaned me as an asset, I think, in a way, to MouthWatch. And then pretty soon thereafter, Brant and I were like, oh my gosh, we need to just work, more directly and get this magic going. Yes.
I'll love it.
That's great. How about you, Brant? You went into business with your father, it sounds like, back in the day.
Well, I started by cleaning instruments and cleaning up dental offices when I was 12, 13 as my part-time summer gig. But no, I was in the Bay Area while Carolyn was growing the Indian Health Services clinics. I was part of .com1 and kind of cutting my teeth in just growing businesses and being part of small teams, really using innovation to transform industries. I enjoyed that. I started one of my own businesses. Then worked as part of a multinational contact center and business process outsourcer to get a little bit more of that experience. Started another company in the health and wellness space, and then sold out of that, and then had some time where just kind of sitting in my dad's practice, helping him do some updates and rebranding while I was looking at what next, but knew I needed to start another company. This is just hardwired masochism that I know deeply, and I come from a fee-for-service Midtown Manhattan practice. That's where my dad grew his business and was a great cosmetic dentist. My stepmom's a dentist, and saw this opportunity based on kind of experience that happened in the office of a patient's reaction to seeing images behind their lower inside, their lower anterior teeth, where you can't see that in the mirror. If people knew a little bit more, they would definitely engage with their dentist more often. So that was the foundation of it. And then Bob Bellhouse, my COO and co-founder, has more large company experience, telecom, Verizon, 9X, and really grew kind of large divisions. So I like that combination of him as an operator, me as kind of a visionary operator, and it really grew and expanded. We saw the need for this to transform care, but we, stumbled a few times. We thought this would be something that smaller, higher fee practices would offer to their wealthier patients, where they could have the camera and they could communicate. And then I've just become this total public health convert, where I see the need was really in increasing access and transforming care in a significant way. And what I love, kind of that combination of experiences, really showed me that the ways, let's say, the most wealthy, well-insured, the patient who's not on the cardiac table because they've got good teeth and they pay attention to their health, that patient and the goals for them are very similar, right? They want convenience, they want access, they want an ease that really helps them be healthier and have a better experience and journey. So starting to align those things where, look, they're not exclusive, right? You can have a traditional healthcare system and you can have a public health oriented system, and you can find a lot of overlap and alignment that efficiency, convenience, connection to care brings and raises the tide for everyone. So yeah, we started MouthWatch 12 years ago. We've been able to kind of grow it slow and steady, and now have 40 full-time employees. We've been able to see this opportunity and kind of go from the hardware side, pioneer teledentistry with an initial platform. And then, the pandemic, while some people were sitting at home waiting to see what happened with work, we were just meeting the need of an entire industry that suddenly wasn't scratching their head of the value of engaging with their patients, and able to kind of keep moving things forward and open up what I think is this new chapter that's really exciting. And we're no longer looking to meet the needs of a practice group that might have 1,000 or 10,000 or 50,000 patients. We're looking to go to a member base that's 500,000 members, 3 million members, an entire state, where we think we can move the needle in a much bigger way and kind of bring practical innovation that patients are longing for. And just, I think, the traditional structure of dental care has not really been able to offer. So we're happy to be in this spot.
Sounds like the best businesses solve a problem, right? And it sounds like if you just really simplified it, you guys provide access to dental care. I mean, that's what you do, if you said it in one sentence, right? So if I'm understanding correctly, you got a couple of different revenue sources. You sell hardware in the form of the camera. You sell software that's a subscription model. And then you also are benefiting from the third-party payors that you contract with. I want you to talk a little bit about that, fill in any gaps, and then let's talk about revenue. We'll get into as much or as little of it as you want. Maybe your revenue run rate, where you're at, where you think you're going. And then if you're in a fundraise now, we can discuss that as well.
And one other thing to add to that, did the dentists in your network, do they pay a fee to belong to that network?
Good question.
Yeah, and we could start there. So the dentists in our network, we pay them. So we're offering that coverage for them, and then, really trying to be the source that brings in broader populations of members or employees or consumers who want that dental consultation, drive that to the provider, and then we'll pay that provider a negotiated rate for the type of evaluation or service that they offer. We're also bringing some different revenue opportunities to the table with some of our providers, where they might be able to collaborate with hygienists in different ways. They may be able to do other services that would come at a different compensation for them. But I think backing out to MouthWatch, MouthWatch is a nice combination of hardware sales. We have 2 cameras. We have a standard definition camera, at a really great price point for most practices. We've come out with a high definition camera. So that's fulfilled into offices and really has changed the game. I think we made it possible. It used to be a $5,000 device that you might have a practice with one camera in an operatory. No hygienist wanted to touch it. They didn't want to upset the dentist if anything happened to it. And we've made it that every chair in every office has a camera. And I think beyond that, we've made it so school nurses can have a camera, pediatricians can have a camera, nursing homes, a range of settings are now set up to get better intraoral imaging. And then really that platform that helps connect them to the provider. And then we have recurring revenue from protective barriers and other accessories that providers and practices will use with our cameras. And then Teledent is Teledent is the SaaS platform where if you have a practice, you can use this platform to deploy teledentistry. So we kind of say it's BYOD, so bring your own dentist is more Teledent. So if you've got providers, you can plug them into Teledent and invite your patients and use that for your telehealth needs. That's really how MouthWatch is built. It continues to grow. We really keep seeing increased presence, not only in private practices and traditional practice settings, but in enterprise and DSO group practices, in schools, in a range of medical settings that offer are starting to get more into kind of what services can they do, or at least really make sure patients don't slip through the cracks in terms of identifying a dental concern. And then Dentistry.One is kind of what we talked about. Those revenue models are about margin on kind of taking claims that we're submitting, just like a traditional practice, but we're really focused on prevention. So we're never doing a crown, we're never doing dentures. We can help patients better understand a lot of that experience and really support them. But some ways it's kind of an emergency triage, some ways it's informational and supportive of a patient journey, and also a wellness play. We're looking to be something that dentistry, when done, is a preventive disease, except for, let's say, a trauma, right? Dental decay and caries are preventable. Mm-hmm. So we can start that journey from the pregnant mom and educate and help support her care. We know that a pregnant mom who's getting proper dental care is $1,500 less in their treatment on the medical side by getting dental care. So start that journey. We're supporting their kids. We can help recommend products, provide education and guidance. A lot of stuff that's just not practical to build into a typical office visit because you're getting 2 cleanings a year. Most people are covered for that. And then you've got 45 minutes to get the cleaning done before they got to flip a room. So time for consultation, time for questions, time for coaching or home care instructions. Nope, you're getting your bag. Here's your floss, your toothpaste, your toothbrush. We'll see you in 6 months. Whereas our hygienists as care advisors can really provide more support and a better experience that wraps that patient, I think, in care that complements kind of the traditional practice experience.
I was going to ask you about, I'm just still trying to understand it from the individual dentist's experience and maybe tie that to a practice I always thought was interesting that doesn't happen in medicine where, dentists would always, a young dentist would buy another person's practice, doesn't really happen in medicine. And they would do that for access to patients, basically. And so with you, this dentist who has a practice and people are coming to his brick and mortar place, that's really not part of you per se. I mean, so he's joining your network, and is all of the work they're doing with Dentistry.One, is that teledentistry? As soon as a patient goes to his chair, is that separate? Is he billing that through his practice? I'm just trying to see how that.
Yeah, so that dentist may work 9 to 5, 8 to 5, 4 days a week, where they're seeing patients in physical treatment. He might also say, hey, you know what, a few hours a week, I want to be available for online consults, some additional revenue, maybe pay off my dental school debt, which is still pretty significant, or some weekend time for asynchronous exams or synchronous exams. But I would think of them as just being 2 separate dentists. One is a doctor who's available for that virtual first approach to care. And then as part of our treatment, we know there is a point where, look, if you present with a fracture, we could talk all day long on a Zoom call, right? I'm not going to be able to treat that fracture. So then it's a referral where we're driving patients in based on the coverage the patient has, based on more and more metrics where we can see total overall quality of the patient, of the practice we're referring them to, and really drive that patient into a practice. And then from the report that our dentist creates based on the condition they present with, we're now referring to that practice, but the practice has a heads up. They know what kind of patient is coming in. The patient's been educated by a dentist on what to expect for that appointment. So that's where we love this collaboration with traditional dental practices is, look, we're here to be a first touch point, but we're going to drive patients in. And then great, we would love it if ongoing that patient communicates with you for virtual care if you offer it through teledent, right? Once they're a patient of record in your practice. But if you're closed and it's midnight and they need someone, we're around. We want to take care of them. We want to make sure they're okay, and then make sure they're getting the physical treatment they need. But something that hasn't come up on this call, which is really exciting, and I know Carolyn and I talk probably too much about it, is there's so much technology coming out with salivary diagnostics, home care preventive. You can remineralize teeth. So if you get decay before it's gone too far through the enamel, a lot of the stuff can be done and supported virtually. So we want to send salivary diagnostic kits to members and patients, help them understand their oral health, use AI to kind of visually evaluate that condition. And if they're really inflammatory, but there's a lot that we can do in supporting your home care to make you healthier before you go into a physical office appointment. Or if we're helping support, let's say, remineralization, it might be something that needs dental supervision. But we're excited to see ways that our dentists can be that one supervising and supporting patients, whether it's moms applying fluoride varnish at home to their kids without needing to go into a site for it. So there's so many things where we're looking to really keep pushing the envelope and, you know, another cliche, moving the needle, right? Some of these people can't get into an appointment. So to what, you know, Jeff Brown said, there's just an ability to really make those practices more, there's such a need that I think if we can deliver direct care to a lot of members and patients, focus on prevention, keep them out of offices, then there's going to be more capacity for bringing more people into a dental care delivery system.
That do need it. No, I get it. The problem you're solving and the solution you're providing is clear.
Yeah.
So part of the mission of Merge Medical is financial empowerment for our members. And so the people that will view this or listen to this, naturally, they're driven to our site for several reasons. That's one of them. Let's talk a little bit about numbers, where you guys are in terms of revenue run rate. If you're in a fundraising round, I'd asked that earlier, but I asked 3 questions at once. So I apologize. Let's talk a little bit about that. Because I think this is a great project. It's very clear to me what you guys are doing and the benefit. Let's talk money for a minute.
Yeah, so that's the ability with MouthWatch and Dentistry.One, where Dentistry.One has a clean cap table. It's only owned by MouthWatch, and we've been able to fund the development through MouthWatch into Dentistry.One without any outside investors. We were looking to raise some money, 6 to 12 months ago, but you and probably a lot of your listeners know it wasn't the best environment for it.
It's still not.
Right. So we really just kind of put the brakes on that. We focused on capturing contracts and implementing and growing revenue. The goal would be in kind of early 2025 to do a Series A, but we want to get our ARR up to, 750,000, $1 million with Dentistry.One, and then start looking at the right smart money that can really help expand us into the broader healthcare space. I think a super exciting part on the investment opportunity is that we're going beyond just dental. We are delivering oral healthcare, but we're really looking to integrate where we're saving medical payors money. We're saving healthcare systems money. We're improving outcomes across the board. I know Carolyn's got a lot of thoughts on it as well, but
yeah, I mean, I think this is where, particularly as we're seeing like risk start to shift and be upside downside, and some rejiggering of where some of those metrics are for independent practice networks and within other healthcare systems. This is where we know there's cost savings for people with chronic and often inflammatory diseases like rheumatoid arthritis, diabetes mellitus type 2. And this is really where the changes are bi-directional. So as you have someone who's on the same medication, whatever medication it is for diabetes type 2, they come into dental care, they get the right type of periodontal treatment, and they get the right home care sort of set up. We know that they're responding much better to that said medication protocol that they had been on without any tweaks. So we know that there's cost savings in the short term and the long term. And we also think with things like salivary diagnostics will be on the forefront of driving some of those same people back into medical care, because there was something that we saw and that we were educated about from our care advisors and our dentists to be able to help encourage that individual back into medical care because something tested positive in what looks like diabetes, or something tested positive and something that looks like oral cancer. So I think some of these things are like just within our grasp, and that are, if we read some of the, what's coming in healthcare in the future from groups like Deloitte and things, we know that there are all of these like multiple diagnostic platforms, and that we're just starting to hit that sweet spot of knowing what to do with it. So this is where we really, plan to stay poised and agile to be able to help magnify that and accelerate, the timeliness of the person getting care, the right type of care for providers, both medical and dental, to be in a place where they are able to, build the types of practices that they want, be it a specialist or, a PCP or a general dentist. And, we have some of those same sort of margin differentials between, primary care doctors and specialists that you have in medicine, just, different like base numbers in dentistry. So I think we also, have that same type of, general dentists have been hit hard with the last 10, 15 years, particularly the last 3 in terms of their practice economics. And they too are looking for ways to be more efficient and more independent and more resourceful. And I think that's like really aligning with what today's person in 2024 wants and expects.
So let me make sure I understand. So MouthWatch is funding the growth of Dentistry.One for now, right?
For now, yeah.
And I'm asking out of concern because, I've been involved with VC stuff for over a decade, and with what Jeff Cole and I are doing, we're seeing so many of these companies, and we're intimately learning their workings inside of their companies. And so many are failing at the phase where they're trying to really commercialize like in a big way, because it takes so many dollars. Like we've talked to so many companies, some of which I've invested in, that are great ideas. They've got the product, they just can't scale. You don't sound like you're concerned about that at all.
No, I don't think we are. I think if we were coming into a broader telemedicine space and trying to compete with Teladoc and some larger, broader medical, yeah, we would need a lot more capital to, I think, get a trajectory to be able to kind of compete at that level.
Is anybody else doing this? That's something Jeff usually asks, but we didn't ask you. Are there competitors trying to do what you're doing?
There's a couple of small competitors within the dental space. Some are using either off-the-shelf telemedicine platforms that don't really fit the need really well. They don't have the scale of network that we do. Others have platforms that we think are lacking. And I think that's where, for us, it's really important to see, one, are you structured in the right way to scale and grow and meet the needs of payers and, especially on the Medicaid side? And also, is your platform equipped for the growth and scale that's going to be coming, and the uniqueness of the dental delivery service, not just a straight up video conference plugin that might go into, Epic or some existing EHR. So I think we're really well positioned in that space to capture all of these opportunities, do it in the right way. We're also about high trust compliant and SOC 2 compliant. So we've got the security basis, all of the things to make this platform meet the needs for scale, the network size that's really, I think, differentiated from kind of what's out there. And yeah, the ability, I think, to meet a range of use cases to reveal value of it. Some of these companies are, looking to be in a spot of just on the difference of what an evaluation pays versus what they're paying their doctor is the real hindrance to their growth. We are not in that position. I think we are in a position to really capture a range of opportunities and not live hand to mouth in a lot of kind of the growth opportunities there.
It's awesome.
No pun intended, right?
Yeah, exactly.
Brant, do you guys have any proprietary stuff, patents, sequencing?
So right now it's more, we've built the platform ourselves. We have some uniqueness within our platform and our journey that we think is a differentiator. We're incorporating that AI approach to an asynchronous scan that really helps engages a patient. But we don't have any patents on that. We're really looking to be kind of the first and best in how we approach the technology and deploy that specific to dental. I think the wrap of services that we offer is unique and differentiated. No one's really doing effective care coordination. No one's doing oral health coaching. These other services that through our network and our salaried staff, we can really do kind of a unique approach to.
I think the real difference when you compare medicine with dentistry is just the fact that in medicine, I'm probably underestimating this, but there's at least 20 subspecialties, and they each have their own subspecialty organizations, and those organizations try to support those members. But what it does is ends up dividing the entire medical provider group. And, I think what MouthWatch being this strong company, kind of centralizing force for dentistry, I just think it makes it possible to build something like this that can really have a more penetrating effect than companies trying to solve within medicine, so to speak.
Yeah, and I think we like the opportunity where within larger healthcare systems, as they're consolidating and covering all of those specialties and subspecialties, is dental is still on the outside of that. So I think that's where we can come in and be kind of the easier referral path and help support, I think, the broader healthcare goals with something that was really fragmented and kind of on the patient side of finding a dental office, finding the care, all of that. So we can bridge that and I think really add some value to, let's say, a larger enterprise healthcare system that wants to support the patients and things that are going to bring better improvements and support their outcomes. But dental is one of those areas that it's just hard to really get to that outcome improvement until you bring in a virtual first solution that really can bridge that gap.
And Brant, one more final question, specific question anyway. We didn't talk about customer acquisition. As I understand it, the healthcare plans, in addition to the patients, obviously, but the patients don't pay. The healthcare plans are obviously your clients. How are you marketing to them and acquiring them?
Yeah, so we have a range of kind of verticals that we're going after. Definitely dental plans are a key one. We're focused on Medicaid right now. We think that's where the fit is ideal for helping them increase access, hit some metrics that measure kind of their success in providing care to their members. We also work with some commercial plans and want to be a part of, look, if this helps distinguish your plan in the marketplace and provide some value. There's some really cool trends on kind of dental loss ratio where commercial plans are being pushed to spend more on actual care delivery. And I think this fits into a lot of those goals that these plans are considering how to deploy some innovation. We're looking at healthcare systems, working with employers directly through benefits brokers, where we can be kind of a layer on top of that conventional dental plan that really makes life a lot easier for their employees. We're going to act like a personal assistant in some ways of helping book an appointment for them and make that journey a lot easier. But we're also going to help them start tapping into those medical savings when they're funding their own medical payouts. We want to help them kind of learn where oral health can really improve and create a savings for them.
That is fantastic.
DSOs we're also working with, oral health companies. There's a range of places where this fits in. Once you kind of take that idea of, well, if I have a clinician available at the drop of a hat to talk to, is it a patient or is it another provider? Is it a consumer of different sorts, where across this journey, there's ways that we can really help bring that expertise to an immediate response for a lot of use cases.
Well, and I'll also add one other area is that, dentistry is rapidly consolidating into DSOs or into, some either dental provider organizations. This gives us the opportunity to be able to go into a DSO of any size across multiple states and be able to be their weekend coverage, their evening hours. A dentist goes out on vacation and they need to kind of figure out which of their patients need to be assessed or brought in. So we can either work with our existing network or credential their providers into our network and sort of label for them. And I think as the industry gets more mature in that consolidation piece, this will be more and more of a need. But again, because we're already credentialed as an entity with most payers, makes this possible.
If I could summarize, MouthWatch /Dentistry.One provides a software as a service teledentistry platform. Partnering with dentists, Dentistry.One improves access to preventive dental care, diagnoses acute problems, eliminates unnecessary ER visits, misdiagnosed issues, and refers seamlessly those patients who do need care to their appropriate dentist in their physical area. Have I got that right?
Yeah, I think so. I think the big difference, we have our two approaches to teledentistry is that one is the software as a service that is deployed by existing practices. The other is that we're kind of a tech-enabled service of clinical care, right? Where we're the provider of care and we've built the platform to really facilitate that. But I think you nailed it.
Excellent.
And I just love kind of the overlap of your Merge Medical as a name, and it's a lot of what we're doing. We're trying to merge medical and dental and really, create that bridge between not only the siloed systems for care delivery, but even those siloed journeys that patients have, and do that with a little bit of technology and just a whole bunch of expertise and ease to really make those patients kind of cross over, start going beyond just the research stage, showing that medical outcomes improve in dental care and chronic conditions can be improved when you take care of yourself and your dental care and treatment, but really start kind of finding more and more of these places of making it easier for patients to reveal those improvements.
I love it. Well, guys, this has been a very good podcast. I appreciate you being here. I'm Dr. Jeff Brown for the Merge Medical Podcast with my co-host, Dr. Jeff Cole, Brant Herman, and Dr. Carolyn Brown, the founders of MouthWatch and Dentistry.One. Thanks for joining us.
Yeah, thanks so much for having us.
Yeah.